The power of support, professionals who speak up. Compensation, what you need to know. Support professionals know what works, and it is time leaders listened. In this video, you will learn about compensation as a direct support professional and why your advocacy matters. Many direct support professionals have questions or concerns about wages, and that's completely understandable. But before pushing for change, it helps to have a clear picture of how the system works. So let's talk about it. How are wages actually set in Minnesota? It's complicated, and part of the reason is that each state, service, and employer approaches this differently. When we talk about pay, it's also important to recognize that it's not just about hourly wages. Once you see the big picture, it starts to make more sense. Benefits are part of total compensation. Compensation includes more than what shows up on your paycheck. It may include things like health insurance, paid time off, retirement plans, training or education support, flexible scheduling. One of the biggest misconceptions is that wages are decided only by the service provider that hires you. That's not really how it works. Service providers do make decisions about pay, but they're working within a funding system that starts much higher up. When funding is limited, providers sometimes have to make difficult choices, balancing things like raising wages, offering benefits, or hiring enough staff to meet service needs. These payment rates are connected to public funding, which largely comes from taxes. Federal and state taxes help fund programs like Medicaid and disability services. When tax revenue decreases or when funding priorities shift, there may be less money available for these services. When funding is reduced or does not keep up with costs, payment rates may stay the same or increase slowly. Providers may receive less reimbursement for services. It can become harder to raise wages or offer benefits. Programs may need to limit services or reduce staffing. Here's a graph that shows an example of how taxes have been used in different priority areas in Minnesota. 1.3 million people in Minnesota receive support from these programs. Funding for services for people with disabilities are included in the Health and Human Services budget, which takes up almost 30% of the graph. We will add the link to the graph in the video description. Most disability supports are funded through Medicaid and Medicaid waiver programs. State and federal policy sets payment rates for services, but usually not wages. Those service rates determine how much providers are reimbursed for services they provide. Service rates can vary depending on service type, a person's needs, and structured funding frameworks created by the state. Service providers receive funding and determine how to use it, including setting wages. While service providers play a role, they don't fully control the amount of funding coming in, and that affects the wages they're able to offer. Now let's look more closely at how this system works in Minnesota and why it matters for direct support professionals. For many disability services, Minnesota uses something called the Disability Waiver Rate System, DWRS. This system calculates service payments using requirements outlined in state law about staffing needs, support level, and program costs. The rates include built-in factors that account for compensation, which includes wages and other benefits, payroll taxes, training time, and administrative costs. This is one reason hourly wages are only one part of a much larger financial picture. In some support services, Minnesota law determines data that must be used for the wage portion of the service rate payment calculation. For example, Minnesota DHS must look at federal data to see how much certain workers typically make per hour. DHS then puts that dollar amount, such as $18 per hour, into the calculation to determine the service rate. These wage rates give providers guidance on what workers might typically be paid based on the type of work being done. Providers often use these wage assumptions when deciding how much to pay their staff, and some may choose to pay more or less. To learn more about the rate-setting frameworks, visit the Department of Human Services DWRS rate website, which will be linked in the video description. So what does this all mean for support professionals? It means compensation is shaped by multiple layers: state and federal legislation on services and taxes, funding formulas, rate systems, and provider decisions. It can also be influenced by things like inflation, regional job market, union agreements, and much more. Because of that, improving compensation isn't just something that happens at the service provider level. It also happens through policy and advocacy. Understanding the system doesn't solve everything overnight, but it helps clarify where influence exists, where change can happen, and why your perspective is an important part of the bigger picture, supporting people with disabilities. This is why the voices of direct support professionals matter. When DSPs share their experiences, participate in workforce conversations, or engage in advocacy, they help inform decisions that shape disability service funding and ultimately wages. Your story is powerful. Your work matters. Your voice can create change. Visit our YouTube channel to view all episodes in the series to learn more. www.youtube.com/@RQCMN. The work of the RQCs are funded by a grant through the Minnesota Department of Human Services.